I'm an emergency nurse practitioner in the UK, and in this video, I'm going to share the steps on how to become an emergency nurse practitioner or ENP. Before we start, let me explain what an emergency nurse practitioner or ENP is. An ENP is a senior emergency nurse who can assess, examine, diagnose, treat, and discharge a patient with minor injuries or illness. So we look after patients with cuts who need stitches, other wounds, broken bones, sprains, and the list goes on. The first step, obviously, is to become a registered nurse here in the UK. You need to be registered with the NMC and be able to practice as a nurse here. Whether you're trained in the UK or overseas, the important thing is having your NMC PIN. After becoming a registered nurse, the next step is gaining experience in the emergency department. Ideally, you want some Band 6 experience before applying for an ENP role. This is because they're looking for more than just clinical skills. They want to see leadership, decision-making, and they also want to see that you can manage patients independently. A lot of people assume that you need years of experience at Band 6 or Band 7 before becoming an ENP, but that's not always the case. For me, I was only a Band 6 for 2 months before applying and getting my trainee ENP post. However, I already had 5 years of emergency department experience as a Band 5, so I had built up my clinical skills, confidence, and knowledge of the emergency department environment. The next step is finding a trainee ENP post. The best place to look is usually NHS Jobs website, where these posts are advertised. Don't only search emergency nurse practitioner because trainee roles may have different titles. Look for things like trainee ENP, trainee ECP, or advanced practice trainee roles. Once you get a trainee ENP post role, the next step will be completing your ENP training. The training pathway can actually vary depending on the hospital. Some hospitals have their own in-house training program and then send you to university to complete the accredited course like minor injuries and minor illness. Other hospitals might send you straight to university modules and you complete your clinical training alongside it. So don't compare yourself with someone from another hospital because every trust does their trainings slightly differently. ENP roles are usually Band 7, while the trainee ENP posts are normally Band 6. The transition from a trainee ENP to a full ENP varies between hospitals. Some hospitals automatically progress you to a Band 7 after completing your training. However, some require you to apply and interview for a Band 7 position, while other places employ you as a Band 7 while you're still completing your training. For me, I was a Band 6 ENP for 3 years before getting the opportunity to progress because of funding. In my experience, it was a little bit vague when I stopped being a trainee ENP. After my in-house training and supernumerary period, I was already seeing patients independently. Obviously, if I had a complex patient or there was something I wasn't sure of, I would discuss with the senior ENPs or one of the senior doctors. But the expectation is that you gradually build confidence and autonomy. During training, you'll also have clinical competencies that you need to be signed off. For example, wound care, you'll get a senior ENP to supervise you and then they will sign your competency document and add some comments to it. Usually, you'll need 3 to 5 successful assessments. This is basically evidence that you're safe and competent to practice independently. At some point, you'll usually complete your non-medical prescribing course. This is a university course that allows qualified nurses and other healthcare professionals to prescribe certain medications within their scope of practice instead of asking doctors to prescribe them. I haven't done mine yet because there were already a lot of people waiting in the queue to have the course. For salary, I'm not going to share my personal pay, but you can look up the NHS Agenda for Change for pay scales. ENP pays depends on the band, years of experience, location, London waiting, and other enhancements. So that's basically the pathway of becoming an emergency nurse practitioner in the UK. It is definitely a journey, but if you enjoy emergency nursing and want more autonomy, it's really a rewarding role. I hope this was useful, and if you have any questions, just put it in the comments. Bye!